Good afternoon, welcome in new episode of Promoitalia channel. Today we are sit in our office in Dubai, Promoitalia office, but I have the pleasure and the honor to have with me two important persons. One is Dr. Nat, that it's from Lebanon, but it's work in Dubai with a lot of customers that after we go to speak about. How are you, Nat?
I'm good. How are you?
It's good.
Very happy to be here.
Thank you for coming. Join us here. And Dr. Accardo, that it's very know well in the world like the father of the trades because he have an unbelievable experience about trades lifting. Well. Tell me a little bit your story, that where you start, what is you know about your clinic now that is the Obagi Medispa, right? Yes. And what is your specialty, what you like, and what experience you have, only from customer of Dubai or all around the Middle East?
So I have over 13 years of experience in the aesthetic field. I had the chance to be working with different nationalities. I do all different types of skin treatments, aesthetic procedures like Botox, fillers, threads, for body, for face, fillers for body, for face, all type of laser treatments. What's nice here in Dubai is that you get exposed to different nationalities and different people require different things. So for Europeans, for example, they go more for the natural look. For the Middle Eastern, especially for the Lebanese, they like it a little bit more aggressive and showing better.
It means all a different, expectation
different
about the beauty.
Expectations.
Maybe European, what you say, more soft touch.
Softer
what you
look,
ask,
natural,
okay?
barely
Natural,
showing
yes.
anyway.
In Middle East, little bit more aggressive, right?
Yes. It depends really on the culture. It depends on what the woman wants. But I try my best to advise the patients to do what's best for them. Especially now with the social media, with all these celebrities going online and they want to look like them, you have to take your time to advise the patients on how to do the things that is best for her.
It's
and
very
to
important
for
psychological.
Her. Yes. Correct.
Yes, psychological, moment with the patient, if you understand.
There's a big psychological aspect to aesthetics, and you should always keep your medical knowledge and experience to order to advise the patient what's best for them. Have some more medical conscious so that because aesthetics is for life. She's not going to come to you now only for a month or two. She's going to be your client for years to come.
Yes.
You have to build up a relationship, and then you can tell her for your plan for more time to come, and then you make sure that she looks only better with time.
And of course, we speak about women and about men.
You have no idea how much I have men. They are more exposed to the aesthetic field. First, at the beginning, they used to come with their wives, with their girlfriends. Now they come on their own. The only difference is that they don't have this much experience and knowledge, but they are big fans of aesthetics, and they love the idea of not aging so fast, and they emphasize more on skin treatments, anti-aging procedures, nothing too aggressive, nothing too showy, more natural aspects.
Okay, and what is the more trendy, procedure that you customer ask to you, and what you want advice to your customer?
So what I advise for my patients is to go more into combination therapies. Aesthetics is nothing magic in aesthetics. I don't have a magic wand where I can just change you.
By the right knowledge, the right products.
Correct. So over time, you teach the patients that they have to always keep coming back because this is anti-aging and aesthetic medicine. It's not plastic surgery. So continuation is important. The technique I like the most to do in my clinic is thread lifting.
Thread lifting?
Threads, yes.
You remember someone in this thread lifting?
Yes, there's Dr. Ciro. I had the honor to be his student.
This is very important because
we're
back because I won't present Dr. Ciro because Dr. Ciro was, the father of thread lifting. Him teaching a lot doctor around the world, and it's very excited to have Dr. Nat, this very brilliant doctor that it's
6 years ago.
And it's changing this teaching, the idea of your beauty for your customer because help a lot the trades knowledge.
Because when you train with the best, they give you the strong base. So he taught me the best technique, the best approach, the best procedure. So when I got exposed to different modalities, I knew how to, manage to make them, to do the best out of them.
It's good. And now we get just ask to Ciro that you know a big experience about molecular traits and about traits methodology. For you, what is the best traits? You know that like molecular and like what's the best?
I still to be the same idea. For me, the best molecule on the market to prepare one good suture, one good thread is caprolactone. I know that today many people use PDO, but in my opinion, PDO never can give long-lasting lifting effect.
We know very well this story, but people that follow us is not know very well. You can explain very shortly why.
The problem is this one: caprolactone can lasting really long time, 3 years, 4 years, 5 years also, depend by the age of the patient and by the lifestyle. PDO don't lasting more than 3 months, 2 months, because the hydrolyzation is too fast. After that, disappear, cannot give long-lasting lifting effect. This is the reality.
Okay, quindi caprolactone for you is the best possibility. But now we talk about methodology, okay? What now is more trendy? The mandibular part, the fox eyes that all people call it, I call it panther eyes, more sexy to be honest, more sexy. Fox eyes is not panther eyes, more sexy. Anyway, this part, what is the part that is more request or you advise your customer?
You have to take the face as a whole. You divide it into 3 parts: upper, mid, and lower face. Today, we don't do just aesthetics in one area. You take the face as a whole and you see what's suitable best for the patient. You can do treatments for the temples, under eye, cheeks, jawline, not just one entity at a time. So I take my time, honestly, during the consultation to try to convince the patient for what's best for her. Yes, they do ask for the fox eyes, they do ask for the cat eyes, they do ask for the jawline, but unless the patient has the proper symmetrical features, I cannot just go ahead and do this procedure. So with regards to the cat eyes and the fox eyes, it depends. You have to assess, the type of skin that they have, how much fat they have. Yeah. I'm saying the right stuff. If they have a good skin texture, high elasticity, correct?
Yeah.
Am I doing fine?
Correct. And a question now immediately pass to you about now that the panther and so that you created, and I was with you because we was around the world for this technique about the eyes, you understand? For you can, what can advise us anyway for have easy technique, not very, for improve that the panther or fox eyes it's remain for a long time? What you can tell to us?
Of course, we was the first in the world to suggest some technique to lift the eyebrow. Today I know that came back this trendy, and they lady like to lift the lateral part of eyebrow, and we can do also with the more easier technique. We can use the linear suture, not the traditional suture, but you need more than one normally, and also you can combine with the filler. Because you can
it's very special in this one because always combine traits with filler.
Yeah, and the effect is nice. The only thing that I think, and also the patient tell me, that don't last a long time. This is the only little part. But you can repeat each 8 months, each 1 year, so you need to repeat the technique.
Okay, and I want to ask for both of you. What do you think if with the traits, we put traits and after anyway we fix this part with botulinum? What do you think about the combination that we can fix and after botulinum that you can take more time? What do you think about?
I always start with Botox because it relaxes the muscle and it helps me better when I do the threads in order to give better lift and maybe use less amount of threads.
It's a way you make this combination?
I always do combination therapy with Botox.
A good idea?
One of our old technique was to suggest to the colleague, to the surgeon, to do before the botulinum toxin on the forehead area, and immediately after 2 weeks, 3 weeks, implant the suture.
Yes, exactly.
For me, it's the best technique because like this, during the fibrosis reaction, you have a non-mechanical perturbation,
Yes.
and the lifting of eyebrow still
It's the
without
natural one.
change.
Okay, thank you for sharing your experience with us, Dr. Ciro. Thank you, Nat, that you know that for you, that I know that you are a super brilliant doctor. That
I had a good teacher.
yeah, but anyway, both as very nice couple about of course
you.
about business. And I promise that we will be again in another channel together. And thank you again for
Thank you for having us.
to talk with us, Ciro too. And bye bye for all kind of our followers. And see you next Promoitalia channel.